join as our hospital team at Nova. So I'm very glad and very excited to share with you guys some of feedback, stories, and also a little bit of refresh and also pull up information. But I bet that you all have joined Activmax quite well, even though better than me. So it's just like refresh and a little bit of information for you guys. Okay. So okay.
Yes.
Okay, so okay, I'm sorry because this is my very first time using Zoom. So if you can't hear me throughout the presentation or if my slide isn't working, please let me know, okay? Okay, so today I would like to share regarding Activmax. It is the ideal solution for diabetic management and also faster recovery. First of all, I would like to share some of the issues that usually patients are having in these hospitals and what are the conditions when they come to the dietitian and what are the diseases that they have to be treated. Okay, how to, okay. Oh, okay. So there are 4 issues in usually that dietitian have to manage it. So the first one is I need to. Oh, wait. Okay, the first one is undernutrition or malnutrition because usually, hospital patients in hospitals, they don't eat a lot. Maybe because of first, it's because of their condition itself, because they're being sick, their bodies are having a lot of inflammation. And second one, because of the medical procedure itself, usually because of after the surgery, they can't eat and their appetite is not very good. So that's why they're undernourished. They can't have that enough energy and also protein for themselves. And the second one that is usually happen in hospitals is because of hyperglycemia, or also known as high blood glucose. Because usually high blood glucose, it can be multifactorial. First, because of the disease itself, because of patient having diabetes. And second one is because of there's this term called as stress-induced hyperglycemia. So when your body in a state of stress, it will increase your blood glucose. And the third one is because of the infection. So infection can also increase your blood glucose. So there's a lot of factors that can make your blood glucose increase. The third one is because of stress and inflammation. And we all know that usually diseases started when your body is being inflamed, when your body is sick. And when these are not treated, there's a lot of stress and inflammatory going around in your body. And the fourth one, and the one that is usually dietitian call is even the doctors are referring that patient to the dietitian is because of diarrhea problems. Because of the, usually diarrhea can be multifactorial as well. First is because of the diseases. Second is because of the medication that is being administered. Usually medication that can cause diarrhea is antibiotics. Okay, antibiotics, laxatives. Okay. Well, I have to keep
Everyone able to see the screen, the slides? Yeah. How about this? Able to see the slide? Yes. Okay. Good. Okay. Yeah.
So I would like to show you the first page first. Okay, this is the topic that we are about to talk today, which is Activmax, the ideal solution for diabetic management and faster recovery. So this is the factors or the diseases and conditions that usually patients are being treated in hospital setting, which is first is undernutrition, second is hyperglycemia, third is stress and inflammation, and the fourth one is diarrhea. So back to where I'm at just now regarding diarrhea, in which diarrhea can be due to multiple factors. First is because of the use of medication, and usually medication that can cause diarrhea is antibiotics and also laxative. And the second one is because of infection, and the third one usually is because of the product that is used by the patient. Usually patient, they can't tolerate to certain products. It's not really about the products, it's actually about the ingredients inside the product that may trigger the occurrence of diarrhea. Okay. And next, okay, so all these problems, the four problems that I mentioned just now, if it's not untreated, it will lead to more complications. So what are the complications? Usually wound healing, infection, weight loss, and no energy. So when these are all is not being treated in the first place, and because of the prolonged illness state, patient will have a very slow recovery. And increased treatment costs mean that they have to undergo a lot of medical procedure. They have to do a lot more of diagnostic tests and everything. And it will also increase the length of stay patient in the ward, means that they cannot be discharged from the hospital until they are fully recovered. So in terms of a dietetics or dietitian point of view, we don't really manage the disease of like medication or what kind of diagnostic test that we want to do with patient, but we are more focused on the nutrition side, which is the integration of nutrition into the patient's condition. So what are actually the key aspects or the overall management that we do to the patient? Okay, the first one is energy. So energy is very important. We have a calorie recommendation and also protein recommendation and fat recommendation that patients need to achieve so that patient can have a better quality of life. So energy is very important that you need to fulfill. The second one is to okay. The second one is to reduce the factor of inflammation and oxidative stress. By reducing the inflammation, you can help patient to have a better recovery. The third one is metabolic control. Metabolic control is regarding the diseases of the patient. For example, if patient having diabetes, so you need to manage on the blood glucose. So if a patient have a hypertension, you need to manage on the blood pressure, not managing in terms of medication or by performing procedures, but in terms of nutrition. And the fourth one is maintaining the gut health of the patient, because of course, nutrition is all about eating, it's all about nutrients and digestion. So it all started with your gut health. So this is the key aspect in terms of a dietitian point of view. Okay. Okay, now I would like to focus on Activmax, on what are we usually tell the dietitian, or the differences of our product and how it can help patient. The first one, Activmax is usually used for recovery, like I mentioned, in helping malnutrition, patient that is underfeed. Second one is for weight management patient. And the third one is for diabetes management. And fourth one, which I didn't put it here, which is for diarrhea management. Okay, so this is just a recap on, I believe that all of you guys have been selling or known Activmax for a long time. So you must know the USP, the benefits of the Activmax. But so this is some kind of a product refreshment to introduce to you guys. Okay, so regarding the distribution of energy, we have 4-4-2, which is 40% of carbohydrate, 40% of protein, and 20% of fat. So as a dietitian point of view, this distribution is very important, because you need to control on the carbohydrate intake by not giving too much of carbohydrate, because as we know, we are currently eating a lot of carbohydrates. So 40% is actually a very good amount for a patient to take. 40% of fat, a healthy fat, and also 20% of protein. Okay, so I will go through one by one, just very short and briefly. So first of all, is regarding the carbohydrate. So we use a low carbohydrate mixture with a low GI. So our source of carbohydrate is high amylose cornstarch, polydextrose, and isomaltolose. So we choose a very a high quality of carbohydrate, in which this carbohydrate are also known as soluble fiber. It's not a high GI, so it also known as a fiber, in which it helps in reducing the blood glucose. Low GI at 28, and we also the distinct or the differentiation between our product and some of the product in the market is that we are maltodextrin free. So why maltodextrin is very, very important, in which you need to limit the amount of maltodextrin? Because studies have shown that maltodextrin, first, it can kill the healthy gut bacteria in your digestion. So when you use a product that have maltodextrin for a long period of time, for example, patient that is bedridden, patient that is need to be on tube feeding for their whole life. When you use maltodextrin over time, your gut bacteria will be killed. So that is why you will have a patient coming to you saying that they have diarrhea problems. So that is why you really need to limit the amount of maltodextrin in a product. And the second one is because maltodextrin is very high GI. So maltodextrin GI is ranging from 85 to 105. So the value is very, very high. So that's why our Activmax vanilla is actually maltodextrin free and also no artificial sweetener. Okay, that's regarding carbohydrate. Now I would like to focus on protein. So our protein is actually a combination of casein, 30% of casein, which is a slow release protein. Okay, so casein is a slow release protein, while soy isolated protein is 70% is intermediate release of protein. So this combination is really helpful in patient, for example, for weight management patient. So why? First of all, it's because of casein. So when you take casein, okay, your body, when you take casein, your body will digest it and it will bulk up in your stomach. So you have a you will feel full longer. It will provide you the satiety. So that's why it's very good for weight management patient, in which they want to use as a meal replacement. They want to replace their breakfast, or they want to replace their lunch, or even dinner. So we have a lot of case study in patients or even dietitians been using our Activmax, saying that when they take it, for example, for sahur during Ramadan, during bulan puasa, they will feel full longer. And usually patients that take it during breakfast, they say that they can sustain the feeling of fullness until up to lunch hours. So that is a very great feedback for patients that want to lose weight by taking Activmax vanilla. Okay, that's regarding casein, the 30% of casein. So moving on is 70% of intermediate release, which is soy isolated protein. So soy isolated protein in hospital setting, I think maybe some of you have heard or not, usually they prefer whey formulation, and usually other product incorporate whey plus casein. But our product is casein plus soy isolated protein. So that is very different than other product outside there. So what are the benefits of soy isolated protein? So the first one is diminish the risk of developing diarrhea. So if you have a patient or you have a customer coming to your pharmacy saying that she or he had a problem with diarrhea, so you need to introduce the use of soy isolated protein. I'm sorry? Yeah. Oh, okay. Okay. So first of soy isolated protein. Okay, why? Because it diminishes the risk of developing diarrhea. Okay. Usually, patient that is very sensitive to lactose, they will trigger the diarrhea occurrence in the introduction of using cow's milk. So usually, product outside there, they use whey protein. So whey protein, although it can claim as a lactose free, but it actually contains 6 to 8% of lactose. So patient that is very, very sensitive to lactose, even that small amount, 6 to 8% can trigger the diarrhea occurrence. But for soy isolated protein, because it is a plant-based, so it really contains, it doesn't contain lactose at all. So it is 0% of lactose. And combined with the casein just now, casein also doesn't have a lactose. So our product is totally zero lactose. Patient can be used it without having problem with the diarrhea occurrence, or without having to worry about the lactose intolerance that they are having. Okay. Second one is for tissue repair and wound healing. So among all type of protein, for example, whey, casein, soy isolated protein. So soy isolated protein contains the highest amount of arginine. So what does arginine do? So arginine is really helpful in tissue repair and wound healing because arginine, it will dilate our blood vessel. So our wound, the wounded area can have a better blood circulation for better wound recovery. So that is why Activmax is also can be used for recovering patient, for wound healing patient, no problem at all. Okay, there's no issue at all on that. And for the third one is for nerve protection, which it maintain the protective layer of the nerve, which is our brain. So that's very crucial. And the fourth one is to maintain muscle mass and strength. It prevents the protein catabolism, which is the protein breakdown. And it also contains sufficient amount of leucine. Leucine is a type of amino acid in which it is very important in the biosynthesis of protein. So that is regarding protein as a whole. So I would like to focus on the our healthy fat blend, in which we have high unsaturated fatty acid and low in saturated fat. So in hospital setting, usually they more focusing on the content of saturated fat, because you know saturated fat is bad cholesterol, and saturated fat is the one that will lead you to many diseases, and usually guideline will recommend.
Okay.
Okay, is everyone can hear me? You can see the screen? Can you hear? Okay, okay. So, okay, where am I just now? Regarding fat. So, we have a mixture of healthy fat, which is very beneficial for our heart health and our diabetic condition. And it also derives from plant oils that it can reduce the inflammation. So, the difference between our product and the others is also that we have 10% of MCT, in which MCT helps in giving us energy for us can to recover better. Okay, that is regarding the macronutrients, which is the carbohydrate, protein, and also fat. So these three macronutrients is very important, and so I've already covered on these three. And I would like to proceed on the fiber. So for Activmax, the total dietary fiber is 7 grams per 100 grams. So our ratio of fiber is 2:1 ratio, in which 2 is insoluble fiber and 1 is soluble fiber. So what are the differences between these two? Okay, first is soluble fiber. Soluble fiber is known to reduce your blood glucose and to reduce your blood cholesterol. So our soluble fiber is coming from Arabic gum and also guar gum. And for our insoluble fiber is coming from wheat fiber. So usually soluble fiber, it will cater to diarrhea cases, and internet connection is unstable. Oh, tak apa. It's okay. Okay, so for soluble fiber, it usually helpful in diarrhea management, and insoluble fiber is helpful in constipation management. So why do we incorporate this 2:1 ratio? Because usually the natural sources such as fruits or vegetables, okay, they usually comprises of 2:1 ratio as well. So that is why we try to make this Activmax vanilla as close as to the natural sources out there. So 2:1 ratio of soluble and insoluble. Okay, so this our unique fiber blend, it can help our gut intestine to digest better. It helps in blood sugar management and also cholesterol management. Okay, this is also important, in which our Activmax is enriched with energy promoting nutrients. So usually if we recap back, what are the symptoms that usually diabetic patient having? So they usually feel fatigue, they usually feel less energy, they can't perform well. So that is why in Activmax Vanilla, we put this energy promoting nutrient, which is coenzyme Q10, L-carnitine, and also alpha lipoic acid ALA, because these three nutrients, it works in our body function, it works in our cycle, in which it will help to convert the nutrients from our food to become ATP, to become energy. ATP is like a power. ATP is like a product in which it helps to generate energy. So that is why these nutrients that we put in Activmax, it will help the patient to feel more energetic, and they can have a better quality of life. Okay, so that is regarding energy promoting nutrients. And diabetes nutrient protector, in which we are fortified with plant nutrients, in which lutein, proanthocyanidins, rutin. So these plant nutrients also, it helps in reducing the inflammation, the stress that is ongoing in our body. Okay. Activmax is considered as, usually in hospital, they have this term as a complete or balanced nutrition. So Activmax is a complete and also balanced nutrition. So first of all, why it is called complete? Because it contains all the 28 vitamins and minerals needed for our body. So why it is called balanced? Because it have the good energy distribution, in which I mentioned just now, 40% of carbohydrate, 40% of fat, and also 20% of protein. So that is why this product, Activmax, is a complete and balanced nutrition, in which you can take it orally or can use it in tube feeding for patient in hospital. Okay, so this is the summary of all the stuff that I mentioned just now. Okay, so this is the packaging. Okay, currently for hospital usage, they don't really use the 700 gram that is available in the retail right now. So they use the 400 grams. So we do have the vanilla and also chocolate. So the one thing that I would like to emphasize here is regarding the scoop inside the packaging. So for the 400 gram, it is 10 gram scoop. For one serving, it contains five scoop. So why it is very important of this scoop? I have to mention regarding this scoop, because usually dietitian, they will not prescribe a patient in terms of serving. For tube feeding patient, usually they don't prescribe patient one serving 3 hourly. No, they usually prescribe the patient 5 scoop or even 6 scoop, 7 scoop, depending on the calorie recommendation or calorie requirement of the patient, so that the dietitian has calculated in the first place. So that is why it's important to mention regarding the scoop, in which 400 gram is 10 gram scoop. And for 700 gram is the 25 gram scoop. So you really need to ask the patient. If the customer is coming from a hospital, I really need you guys to really ask the patient if the prescription or the regime from the hospital, whether it is a 10 gram scoop or whether it is the 25 gram scoop, because we really need to standardize the prescription from the dietitian. Okay. So this is one of a highlight that I really want to mention, which is Activmax is made in Malaysia, and usually in hospital they will prioritize those man-made, Malaysian-made product, in which they have like this ranking. They rank the enteral products. So usually those product that is Malaysian-made is actually they will choose it more than others. So yeah, we should ask your patient to support Malaysian-made product. Okay. Okay, so how do dietitian apply this Activmax or use this Activmax in hospital? So usually they have these two types, in which first is oral nutrition supplement. So oral nutrition supplement, or better known as ONS, is usually they give to the patient as an additional of their dietary intake, usually 3 to 4 serving. It means that patient also take their usual dietary intake, but maybe their intake is very low. The amount of food that they take is very minimal. It doesn't achieve the requirements. So by having this Activmax, it can add on to their dietary intake. Usually when they take like lunch, they can have like 1 serving of Activmax, or in between meals, between lunch and also between dinner, they can have another glass of Activmax. Okay, so that is called as oral nutrition supplement or a meal replacement, in which they replace the whole set of their breakfast, lunch, or dinner with Activmax. And the second one is tube feeding. Okay, usually we can see this a lot in hospital setting, those in ICU cases, critical cases, in which this tube feeding is calculated based on the calorie of the patient. So the dietitian will decide whether that patient can take 6 serving per day or 7 serving per day according to the requirement by the dietitian. Okay. So I think I've already shared regarding the USP, the benefits, the characteristic of Activemax and everything. So I really want to share with you guys what are the hospital feedbacks on Activemax, what our hospital team had been doing when we went to the dietitian. So all of them reported that when they gave Activemax to the patient, the blood glucose control. So there's this one patient in ICU setting in which that patient is having a very high amount of blood glucose. So can be due to because of diseases itself, because of the stress state of the patient. So when dietitian changed the product to Activmax Vanilla, the one, our product, so the blood glucose from double digit, from 13, 14, after the usage of Activemax in one day, the blood glucose can reduce to single digit, to 9 millimole to 8 millimole, and it is in control and stabilized blood glucose. So that shows that Activmax is very good in blood glucose management, because usually there's some products that when you give to the patient, the blood glucose will spike up, because suddenly patient will have like the blood glucose from normal state, it can spike up. So upon feeding, so that is maybe because of the product itself. So but with our Activemax, all of the feedbacks nowadays showing that there's no complaint at all when they change the formulation, or when during the feeding the blood glucose can be controlled. And another thing, in hospital setting, usually our product is very well known in treating diarrhea. Usually patient there's cases that I really remember when there's a hospital that we go. This patient is having a very bad diarrhea. Okay, so first of all, dietitian tried with a diabetic formulation. There are two diabetic formulation that the dietitians try, but then the patient cannot tolerate it at all. Patient keep on diarrhea, and the second one, and then dietitian tried to change. She changed to fiber enriched formulas, a formulation that is high in fiber. So when the dietitian changed the formulation, the diarrhea is reduced, but then the blood glucose is higher, because that product is only caters for high fiber. Then the dietitian changed again to semi-elemental formula. Semi-elemental formula is actually the one with hydrolyzed protein, in which it helps your gut not to digest very hard or very difficult. It means that it's already been digested for the body. So when dietitian changed to a semi-elemental formula, the diarrhea is not reduced, but then the blood glucose is still haywire as well. So when the last choice, dietitian changed to Activemax, both the blood glucose and also the diarrhea can be resolved. So that is why our formulation, Activemax, has been used in hospital in treating diarrhea cases and also blood glucose cases. In hospital, they also use this fiber modular, means that they don't change the product that the patient has been using currently. For example, per patient is using product A. So this product A causing diarrhea. So they don't want to change that product because of cost issue, because of the brand trust. Okay. So they want to add on fiber modular. So usually fiber modular, all of the feedback that we show, first of all, some of them it doesn't work. The fiber modular doesn't work. The second one, the fiber modular does work, but it takes longer time, usually 4 to 5 days. But then when they did a case study, when they changed the formulation with Activemax, in one day, Usually for tube feeding, we can have 6 to 7 serving of the formulation. So usually in 4 or 5 serving, the diarrhea can be resolved and the blood glucose can be controlled as well. So I think it's a very good feedback from the dietitian, and all of dietitian actually loves Activmax because of that feature, in which it helps in diarrhea and also in blood glucose in one time. Okay. And also, if you have this our Activmax vanilla, it is actually, it has a mild sweet taste. It's not as sweet as other diabetic formulation. So what's the unique thing about diabetic patient? Usually diabetic patient, when they take something that is very sweet, they will feel like, manis sangat lah susu ni, makcik tak boleh lah nak minum, makcik kan ada diabetic. So they tend to not to drink the milk that we give to them. But with Activmax, the taste is mild sweet taste. So patient that is diabetic, dia akan rasa macam, oh tak manis, okey ni untuk orang kecil manis macam makcik. So they can consume the Activmax for themselves. And for hospital, a patient in hospital, usually they have this problem in which they took milk for a long time. So there's a one time that they feel that they can't take any milk taste, they can't see any white color anymore. So when they give Activmax vanilla, because of the high fiber and because of the protein blend that we use, the soy protein and also the casein, our Activmax tastes like wheat. Feels like a soy formulation. So when they drink the Activmax, it can dia boleh tahan rasa tu. Tak rasa macam feeling of vomiting, feeling of wanting to throwing up. They can tolerate the taste. And because of our Activmax comes in chocolate version as well, so patient can enjoy these two version with the same benefits as well, because it doesn't, dia tak lari jauh between vanilla and also chocolate. It provides the same benefit and also the same USP and ingredients. And we also have a case study in which Activmax can resolve constipation, not only diarrhea, but also constipation. Remember the fiber blend that I mentioned just now, in which we have 2:1 ratio of insoluble and soluble. So this, the great thing when we have a blended protein is that blended fiber, is that it can help in both diarrhea and also constipation. So we do have a case study in which patient does not have a bowel opening ataupun tak membuang for a long time. So when they take Activmax, after 3 serving, patient dah boleh pergi toilet, can relieve the constipation, dah okay kiranya. Okay. So our Activmax also is suitable for a variety of patients, including ICU cases. So kalau macam there's a customer saying that whether Activmax is it safe to use, okay ke tak nak guna, selamat ke tak, no worries at all. Hospitals have been buying with us. Hospital has been purchased our Activmax, not only for plain medical cases, but up until ICU cases, those with a lot of complication and also critical cases has been using Activmax with no problem at all. And also because of our affordable price, so that's why a lot of patient is coming to us to buy the Activmax. Okay, so so this is just a simple case study for the diarrhea management, in which we have a patient diabetic with diarrhea, antibiotic resistant, because patient that is usually being administered with antibiotic, the side effect is a diarrhea, and it's a very frequent watery loose stool. You can have like 5 to 7 episodes of diarrhea in a day because of the antibiotic. And then acute diarrhea. So when dietitian compare case study, when they compare our formulation with other type of formulation, when they change to Activmax, like I mentioned just now, in 4 to 5 serving, the diarrhea can be resolved immediately, no problem at all, and also blood glucose is controlled. So I think that's all my sharing regarding Activmax. So please let me know if you have any question or you want to ask anything in terms of a dietitian point of view, hospital setting, or anything. Feel free to ask. Okay. Mine is okay. Is there any question or is there anything that you want to ask? Thank you for participating today. It's my first time and I feel very excited to talk with you guys, even though I can't hear you guys. Okay, what is the property of Activmax that can treat diarrhea? Okay, so we also have this question coming from dietitian as well. So usually we will explain on these three points how Activmax can resolve diarrhea. First point is because maltodextrin free. Why maltodextrin free? Because like I mentioned just now, maltodextrin can kill your healthy gut bacteria. So if a patient is being for tube feeding for a long time, it's being bedridden. So over time use with a product that contain maltodextrin, it can kill your bacteria and it will cause diarrhea. So Activmax has no maltodextrin, so that is why it can help resolve diarrhea. So that is the first point regarding maltodextrin. Second point is regarding the protein blend, the casein and soy isolated protein, because these two protein blend, it doesn't have lactose, because lactose intolerant patient, because in whey protein 6 to 8% of lactose, that small amount of lactose can trigger the occurrence of diarrhea. So by using our protein blend, which is casein, and also soy isolated protein, which is a plant protein, you don't have that amount of lactose at all. So it is safe to use even for lactose intolerance patient. So that is the second point. And the third point is because of the high fiber. So Activmax is deemed to be as a high fiber, which is one serving is 3.5 gram of 2:1 ratio of insoluble and soluble. I would like to remind again that soluble, it helps in diarrhea management. Insoluble, it helps in constipation. So it can cater for both conditions. So that is usually the 3 points that we will tell dietitian, which is the first one, maltodextrin free. The second point is because of our protein blend, and the third one is because of the high fiber content. Okay. So I hope that answered the question regarding the diarrhea management. So any other question that you want to ask? Okay, so I guess that's all from my sharing today. Thank you very much for participating, and I hope that this session is very beneficial for you guys. And I just want to say that stay safe and let's help more patients and more customers in achieving a better health overall. Bye, see you again.